Today we have 41 new cases of COVID-19 in the state. This is the highest single-day number reported to date. Last Friday we reported a high of 29 cases. Back on April 3rd, we had a report of a high of 34 cases. These high numbers are a concern for the department, and they should be for everyone else. It's an indication that disease activity in Honolulu is circulating more widely. We still have the lowest number of cases and deaths in the nation and have the ability to change the curve, to get the curve back down to where I think we would want to see it going forward. But the trends are very disturbing. Over the past months, most of the cases have been associated with known cases or clusters of cases. We are now seeing more cases without a history of exposure to other known cases or clusters. We have increased surge staffing within the department and are in the process of hiring our newly trained contact tracers. I do not believe in the short run we have any significant issues associated with contact tracing. Nevertheless, it should be recognized that contact tracing is a reactionary step. It helps to assure that we've found those who are likely infected, but it does not substitute for the social distancing, the face mask wearing, and the other preventive measures we've all been taking. We must adhere to masking and physical distancing, as no amount of contact tracing and testing will effectively combat the respiratory pathogen that is now circulating in our community. We anticipate these numbers will likely continue at these levels with the activities in the state. More people are out and about. We're enjoying businesses being opened. And with the prospect of our schools opening soon, college students coming back to Hawaii, this all depends on our ability to keep the disease in check and to provide a safe environment for those activities to continue. Some of the cases are associated with closed spaces like gyms with poor ventilation. Some have limited workplace spread, sometimes associated with lax wearing of masks and other physical distancing. Many cases are household contacts, which emphasize the need to self-quarantine if you're exposed to someone who is positive, who is a positive case, and to self-isolate at home if you are a case. The clear message is to wear a mask and stay away from others at home if possible.
So our team at the department has been busy investigating a number of clusters and cases, primarily on Oahu. I think we should also remind folks that although most of the disease activity is Oahu-focused, the danger or the risk is statewide, and so we do monitor and investigate the occasional cases that are showing up on the neighbor islands as well. And so we have to be mindful statewide about the potential risk from this disease, that it is ongoing. We're in the middle of a marathon. Actually, we're probably not even in the middle of it. We're still in the beginning climbs of it. And so it's going to be a long haul for all of us. And the disease that we're seeing, the disease activity we're seeing primarily in Honolulu, is a reminder of that. In terms of the investigations that we've been engaged in, I could go through the entire list of all the clusters and such, but I think the point is that we're seeing disease occurring in clusters that involve as few as a couple of people to as much as 15 people, all associated with whether it's a gathering such as a Father's Day party. One such one that we keep seeing more and more cases, chain of cases associated with a Father's Day party, for example. We've seen, as mentioned, a gym cluster, and we've seen others associated with, we've seen a business trip that went to a neighbor island, actually to the Big Island, that we're seeing cases associated with that, as well as trainings that held by like Hawaiian Airlines, for example, where the number of individuals in the training has been involved. And the common theme we're seeing oftentimes is that people are letting their guard down, that our community is thinking, has interpreted reopening businesses and getting back together as it's safe to be together again. And, to a certain extent, that's true, but to another extent, it isn't exactly true because we're living in a world where COVID exists. And what that means is that even among our friends or family we haven't seen in a while and that we aren't going to be seeing consistently day in, day out, they're not part of our, what we call our bubble, if you will, we need to mask up. we need to keep our distance. So it's okay to see your friends again. It's okay to be in a training for business and such, but keep your distance and mask up around each other, wash your hands. And unfortunately, that's our world for some time yet, until we see a vaccine or an effective medical treatment or other interventions that may help to combat this virus. And so that's what I hope our community remembers out of all this. As mentioned by our director, we do have the resources right now. We've surged in the department to have the ability to contact trace. But contact tracing and testing doesn't solve everything, just like masking alone doesn't solve everything, or physical distancing alone doesn't solve everything. It's all of these things in combination together that will help combat the virus, and will make sure that Hawaii continues to be a safe place and is seen as a safe place. So that's it. Thank you.
Thank you very much, Dr. Park.